Hi, good afternoon. My name is David Ramirez. I'm a family physician here in Edinburgh, Texas. And I just want to say thank you to the RGV Diabetes Association and, of course, Happy Healthy Valley for hosting me and for giving us the opportunity here at STRI to kind of give you guys a little bit of overview of what we do and to talk a little bit about fatty liver disease, or metabolic associated liver disease now as it's known, and its association with diabetes. And so I'm really happy to be working with both the RGVDA and with Happy Healthy Valley and really resonate with y'all's mission to educate and to provide resources for our people in our community here in the Valley. So, as I said, I'm a family physician from Mission, Texas. My wife and I are born and raised here in this area, and always had a passion for primary care and just prevention in general. And recently had the opportunity to come work here at STRI, which is South Texas Research Institute, and founded by our liver specialist, Dr. Rashmi Patil. And very, very excited to let you guys know what we can offer the community. And what we do is free screenings in addition to clinical research trials, which I'll let you guys know a little bit about. So diabetes, you guys, that are listening to this are well-versed in the burden, that it causes, both from a monetary standpoint and from a physical standpoint, not only individual patients, but our community as a whole. Those of us that are from the area, especially, we live in one of the highest prevalence areas, or one of the most prevalent areas for diabetes, and especially its complications, right? We see the complications as a family physician. I see it in the clinic. I started working initially in the beginning of my career as a hospitalist at a local hospital, and would constantly admit patients with the complications from diabetes. And these can include peripheral artery disease causing amputations, or infections of the toes and the feet, very, very high blood sugars, or even very, very low blood sugars, diabetic ketoacidosis in patients going into the ICU, just general infections, right? That non-diabetics may do a little bit better with, like pneumonias or regular upper respiratory things that can cause even worse sequelae or even worse outcomes in diabetics, right? And so in addition to that, we get very, very strong training in medical school and in residency especially about these generally accepted complications of diabetes. But one of the things that we don't get a lot of information about is about its effects on the liver. And so there was recently a meeting in Europe called the European Association for the Study of Liver Diseases, EASL. And they recently announced a name change. What we used to know as fatty liver disease is now called metabolic associated liver disease, or metabolic associated steatohepatitis, or MASH, or MASLD. And so what this is, or one of the ways that this forms, is a manifestation of, let's say, diabetes or other metabolic disease in the liver itself. And so the liver should have a little bit of fat. We get that from genetic pathways, from normal biochemical, biophysical pathways. We also get it from the food that we eat. Food high in carbohydrates get transformed into the liver, and the liver stores some of that fat, or some of those carbohydrates as fat, right? We use them for energy. When we have too much of them, more than about 5% of our total liver mass, it becomes toxic, and it becomes starts to form an inflammatory reaction. And so that inflammatory reaction causes scarring, fibrosis. It causes stiffening of the liver. And the thing about it is that stiffening does not cause symptoms initially. The symptoms there are no symptoms. And so a lot of us are walking around, myself included, because that was one of the first things that I had done when I started here at STRI, was I got myself a fiber scan, which we do here, which I'll talk about what those are. And I found out that, hey, I'm on the spectrum as well. And a lot of us have this fatty liver disease, or this metabolic liver disease, and we don't know it. There are 4 stages to it, and there really isn't symptoms until we get into about that 4th stage, which is liver cirrhosis, and we'll talk about it. So walking around in general, 38% of the population has fatty liver disease, and about 14% of the population has the more aggressive form of fatty liver disease we call NASH, or I guess MASH now it's called. But in diabetics, 70% of diabetics have fatty liver disease, and 35%, half of them, have the more aggressive form of fatty liver disease. So why do we care about fatty liver disease if the first 3 stages don't really have any symptoms? Well, we do know that whether we're symptomatic or not, that every stage that we increase, we go from stage 1 to stage 2, stage 2 to stage 3, we increase our overall risk of death. We're not exactly sure why, but we know that that's one of the outcomes that we're worried about, especially in our diabetics who are at a much higher risk than the general population for developing the complications. But what we really want to prevent is that stepping into stage 4, that liver cirrhosis. And it's the same kind of cirrhosis that our family and friends or people that we may know that drink heavily, right, drink alcohol heavily, develop. It's the exact same thing that we're trying to prevent. It's the same kind of pathology, the same kind of scarring that we see inside of the liver. And at that point, absolutely we see symptoms. And in my short career as a hospitalist before, I would admit patients from the ER or downgrade them out of the ICU to take care of them on the floor. And they would tell me, you know, they would have what we call decompensated liver cirrhosis. And they would tell me, pues, mijo nunca me tomó mucho. Never did I ever drink heavily or, you know, a vez en cuando here and there, but where did this come from? And a lot of our patients that we see that have underlying diabetes, hypertension, high cholesterol, hypothyroidism, obesity is a big one as well. Metabolic disease. So we know that metabolic disease can lead to this. And so that's what we're trying to prevent, because at that point, the options are a lot more limited. And then at that point, at the stage 4, which is cirrhosis, we know that our risk of liver cancer goes up, and then especially our overall risk of death goes way up. So, but there is hope. If you have been diagnosed with liver cirrhosis, there is hope to maintain you, to keep you in what we call compensated cirrhosis, to keep you stable and to keep you living long and healthy life. What we can offer here at STRI, or at South Texas Research Institute, and we have a facility here in Edinburgh, Texas, and then one in Brownsville, and we're part of a larger network called Pinnacle Clinical Research throughout Texas, and now kind of opening to the Midwest and the Southwest. We offer free liver scans, and so these are called FibroScans. It's a quick, painless type of ultrasound, basically, and it takes our technicians about 5 minutes to do. And what they do is you have to be fasting for 3 hours, and when we fast, it allows our liver and the blood flow to our liver to kind of calm down. Our liver goes to its basic or steady state, and we're able to shoot ultrasound waves in with the probe, and it rattles the liver. And based on how the liver rattles, we can tell the stiffness of the liver and the quantity of fat in the liver. And that gives a clinician like myself or Dr. Patil or even your primary care physician a lot of information as to the health of the liver. And based on the stiffness, we can tell about what stage of fatty liver disease that you are in, if you do indeed have it. We know here in the Valley, about half of us have it, and they're walking around with it and don't even know about it. And like I said, if we're diabetic, 70% of us have some stage of fatty liver disease. So I strongly encourage, as a primary care doc and also as a clinical trial specialist, I highly encourage, you know, our diabetic family and friends and community members to get checked. We definitely offer that. There are other places in the Valley that offer it. Everything we offer here is free. So we would give you the FibroScan, which is that ultrasound, right? And then send a copy to your PCP. And also, if you have what we call at-risk NASH, or we're concerned based on, you know, how stiff the liver comes out, we can offer you a clinical trial. And so what that means is that before any medication is approved here in the United States and around the world, they have to go through clinical processes, and where the medication is made sure that it's safe and effective. And so we can allow the patients, or we can give you guys the opportunity to get access to the medication before it's approved. Then doctors like myself or Dr. Patil or our nurse practitioners will follow you throughout the clinical trial. It's all free. Usually it involves an MRI or a liver biopsy or other advanced testing, so we find out exactly what's going on with the liver and if there are any genetic components or anything else that could be contributing to the overall disease state. It all is voluntary. At no point is a patient ever locked in, and everything, like I said, is free. So we don't use insurances, not even social security numbers are required. If you're a patient, if you're alive and above the age of 18, you can come and get screened, and we can definitely offer you that care. And also, we have a lot of patients that are like, pues mijo, no, I don't want to be part of a study. That's okay too. We can see you every 6 months or every year, depending on your risk, and show you exactly where you are based on your FibroScan, and and even some blood work, some basic blood work. So we just want to offer our services to not only the patients and the members of the RGVDA and Happy Healthy Valley, but just anybody watching this video today. You don't need to be referred by your doctor. You can call us directly or find us on our website, which hopefully we can link in the comments below or in the description. And we're here to serve the Valley. Thank you for your time.